My name is Michael Trail. I work with the Jericho Society, who has a number of houses around the country. I'm involved with the two houses in Greenock. It's residential drug rehabilitation, total abstinence projects, one separate genders, a house for men, a house for women. Whilst we don't believe there should be any dichotomy between harm reduction and abstinence, and that we shouldn't be competing with each other, we're passionate that there should be a slice of the funding that goes towards abstinence. In the 16 years we've been running, despite having the best outcomes in United Kingdom by far for total abstinence, continuous total abstinence, we've only ever had 4 people out of the 600 people through the two services funded. If this was to continue, we wouldn't be able to sustain those services, which would be a false economy in that, using the government's own figures of 40,000 in 2009, they calculated it was £40,000 in healthcare criminal justice costs per using addict. Just to be in our service costs a quarter of that for the year, because we think it's actually criminal to profiteer from people that aren't well. So we only want to cover our costs, which we can't do unless the drug budget eventually gives us money. We were part of trying to get addiction moved over into healthcare instead of criminal justice, which I think in a couple of generations' time they'll look back and see how absurd it was to be punishing people that aren't well. I'm a recovering addict myself, really passionate about everybody getting the service that they need, whether it be harm reduction or abstinence. But those that are choosing to come Jericho's way won't be able to come our way unless the government eventually listens to us and gives us some of that money. I know this has been a wee bit of a Jericho-centred plea, but I've got to use any platform I can. And regarding reducing deaths, if you go to any mutual aid meeting around the country, it'll be very hard to find to go into one that there's not a Jericho ex-resident, because we've got hundreds of people all active in recovery. We've made huge impact in recovery, and regarding reducing drug deaths, we believe the numbers would have been well into 4 figures years ago if it wasn't for the work that Jericho's been doing.